Hello everyone, how are you doing? Welcome to another video of Bovineology. Hello, so last week we had the opportunity to have an invited speaker to talk to us about particular problems that can happen during synchronization of ovulation protocols. So of course, after insemination, what we want to do is pregnancy examination in order to identify if this animal got pregnant or not. So our goal is to have the animal to get pregnant, right? So today we're going to talk about some landmarks that we can evaluate, that we can feel doing rectal per rectal palpation for pregnancy diagnosis. Okay, so I want to show you two nice things this week. We're going to talk about this, and I want to show you a very nice tool that I particularly used, and I know that this is going to be really nice for vet students, for practitioners, and also for you guys in the farm. This is going to be really nice. So this is called the Drost project. So the Drost project, of course, was put up together by Dr. Martin Drost. He is a professor here at University of Florida. We're very happy to have him. Dr. Drost has extensive experience in the field, extensive experience in research, and over his years practicing, he was able to put together so many pictures, and then he made the Drost project so he can share these pictures with us, and it's actually helped us to learn easily. So I think a picture speaks more than 1,000 words, right? So we're going to see a couple of them. But just to show you the website, Visual Guides of Animal Reproduction, this is where his library of pictures are, and you actually can browse through multiple topics, and you can see multiple pictures for the topic that you're interested in. But today we're going to talk about pregnancy diagnosis per rectum, pictures of a couple of things that we're going to see when we palpate animals. So the first thing that we can feel when we palpate animals, usually 30 days after the insemination, 30, 31, 32, is asymmetry of uterine horns. So this is an indication of pregnancy, and I'll tell you why this is not a definite sign of pregnancy. So of course, if the animal is pregnant, there's something on one horn that is not on the other, except it is a twin, right? So the concept is going to be on one horn, and that's why it causes asymmetry. But what happens is there are animals that are multiparous, meaning that they have multiple babies over their lifetime. And most of the pregnancies happen on the right side. It doesn't mean that we don't have pregnancies happening on the other side. But what I mean is, you're going to have a natural symmetry of uterine horns, and it progresses as this horn is the one that is the pregnant horn multiple times. So we're expecting in multiparous cows to have a certain level of asymmetry. So we cannot take asymmetry as a landmark, as a definite sign of pregnancy, but it can give you an idea that the animal is. So you have to keep looking for the other signs. So as I said, around day 30, after the insemination, is when we palpate these animals per rectum. This is another picture of horn asymmetry. This website has so many pictures, and I'm gonna just go over to the ones that I want to focus on. Otherwise, the video gets too big. But I really advise you to get to this website if you're interested in these topics. You're gonna see some great pictures. So this is the first sign that you can conclusively say that the animal is pregnant, and is sleeping the chorioallantoic membranes. It usually happens between day 30 to 35. So if you grab the horn and you lift it, you're going to feel a membrane sleeping all the time. You can do it 2, 3, 4 times. You're not going to damage it. So just you have to be gentle, of course. But if you feel the membrane sleep, that's the first indication that the cow is pregnant. And that's actually one of the landmarks. So if you feel the membrane sleep, you can say that this animal is pregnant. So this is the membrane sleep outside. This is the membrane outside the uterus. A couple of days after that, around day 35, we can actually feel a amniotic vesicle. The amniotic vesicle has the conceptus inside of it. So when we palpate the animal, what you want to do is retract the uterus and feel the entire horn, right, left. So the membrane and the amniotic vesicle, at this point, they're very, very small. So, and they're usually on the tip of the horn. So you want to retract the entire uterus and feel the entire horn so you don't lose the pregnancy. But amniotic vesicle, what you're gonna feel is like an olive, and you can actually squeeze it a little bit. Don't rupture it, but you can squeeze it a little bit, and it's actually interesting to the feeling you have. Here we have another picture of how to localize amniotic vesicle. So we can see that it's on the tip of the horn. It's not actually close to the base. It's not very easy to grab, especially multiple scales where this uterus is already flaccid, is already towards the floor and not a small uterus that didn't have many babies before. So hand measurements, you can actually use your hand to measure the fetus. Around day 60, you can actually feel the fetus. And that's just because that amniotic vesicle starts drying. So the amniotic sac is flaccid enough to permit direct palpation of the small mouse-sized fetus. And then actually here are different sizes of fetus. Of course, as pregnancy progresses, it's natural that the fetus is going to grow. So you're going to keep looking for all the landmarks that I'm going to show to you, but you can also feel at certain point, you can feel the fetus, and it's going to be actually easier to feel it as it grows. So around day 90, you're going to be able to feel the placentome. So the placentome is one of the distinct characteristics of the way the placentomes are, is one of the distinct characteristics of the ruminant placenta. So these placentomes are diffused throughout the placenta. It's just not, for example, in the equine, that is one big thing and that's it. No, the placentome, the connection between the mom and the baby that exchanges nutrients, for instance, is diffused throughout the placenta. So actually at day 90, the placentomes are big enough that we can feel them when you pass your hand on top of the uterus. So this is a picture of exposed placentome. This picture is very nice because it reminds us that we're doing perectal palpation. We want to retract the uterus. We want to diagnose pregnancy, or if the animal is not pregnant, of course, as well. But we have to be careful because this is an animal, this is not a walking uterus, and you can actually hurt the animal and you actually kill the animal depending on how brute you are. So here we have pictures of rectal trauma, rectal edema, non-perforating mucosal tear, severe mucosal trauma, so on and so forth. So here we have a Dr. Martin Drost. Here's just one of the one of the ways that we have here at university to teach students on wet labs on how to retract the uterus, how to diagnose pregnancy, the landmarks. We see multiple uteri with different sizes, so different stages of pregnancy. I'm not gonna comment about them. But here in this picture, we have multiple pictures of multiple uteri at different time points in pregnancy. And as I said, asymmetry at day 28, this is one size. And as I said, as we progress with pregnancy, it's of natural that the uterus is going to get bigger and bigger and bigger. That's because the conceptus or the fetus gets bigger, bigger, and bigger and bigger. And then it actually is easier to diagnose, right? So usually what is done in dairy farms is around day 30, if you're doing perectal palpation to diagnose pregnancy, around day 30, 33, you want to do the first pregnancy examination. And of course, if you're using ultrasound, you can do a little bit early. You can do as early as 28 days or somewhere around that. We're going to have a video just talking about it. But you can do around day 30 if you're doing perectal palpation. And then if the animal is pregnant, you want to recheck 30 days later. So there is a percentage of pregnancy loss, means the animal is pregnant on the first preg check, and on the second one, on the reconfirmation, the animal is not pregnant anymore. So that's pregnancy loss. We're gonna talk about pregnancy loss, the effect We already actually talked about a couple of uterine diseases that affect pregnancy loss, increase pregnancy loss, right? So here we have palpation of near-term fetus, and here we have palpation of the uterine artery. So this brings me to the last landmark that, of course, does not include the fetus itself. That is, you can actually palpate the artery on the pregnant horn and on the non-pregnant horn, and you can actually feel the blood flow, right? So that's called the fremitus. So around 100 days within pregnancy, you can feel fremitus, so you can feel the artery shaking, pulsing in your hand on the pregnant horn. And around 200 days, so double the time, you can feel the fremitus on the non-pregnant horn. And so it's common practice also that if the animal was pregnant on the first preg check and on the second preg check, before we dry off, meaning we're going to stop milking this cow and we're going to give her around 60 days to rest, recompose mammary gland, and prepare for parturition, we do another pregnancy examination to make sure that it did not abort. So that's it for today. I hope you like. If you like the video, please share, subscribe, and I really hope you guys can take a look at this website. It's really nice. It's really cool. I myself do it sometimes. And next week, we'll be back next week with pregnancy diagnosis through ultrasound. Thank you.